Hi, it's Dr. Doug Curtis.
And Lucy Curtis from Dyslexic and Unstoppable, and we're here to help dyslexics rediscover their inner power and become unstoppable.
Yep. And today we're here with another one of our videos in the series of dyslexia and ADHD and how to tell the difference between the two. Mm-hmm. As we said in previous videos, we have the Vanderbilt Assessment Scale, which we use to diagnose ADHD, and we're going to go through some of the questions and see what they look like in ADHD and what they look like in dyslexia. So the third one that is on this list, this one that we're going to go over this time, it says does not seem to listen to when spoken to directly. And in kids with ADHD, I mean obviously that's what you see, they fidget and they look around and they don't seem to be paying attention. But how could a kid with dyslexia show up like that?
I know that Felix Alexander sometimes when he was nervous and he or he had to read something and he didn't understand it, and it wasn't that the looking at you, but it was more like put on the spot, right? So you're put on a spot and you have to read something and you can't read it.
Right.
So then you're like
looking around.
So you feel like, oh, I don't know the answer, or like you're put on a spot in the classroom and you don't know the answer. Mm-hmm. So I think that's one place that he would. It would look
like this question is correct.
Yeah.
Yeah. So how could a parent tell the difference between, or how could a teacher tell the difference between that child with dyslexia who seems not like they're not listening, but they really are, they really can't, and the kid with ADHD who is actually just distracted?
I always say you have to go back to the basic of, is there a learning issue? Mm-hmm. Is there a learning issue? Do they have issues with their writing, their reading, their spelling? Speech issues. You always have to go back to the basic and see if you've looked at all these things and there's no issue, then I would say, yeah, probably there is ADHD. But if there's, and I see that in some friends or people that I talk to, they have the writing, the reading, the speech, and then they're just saying, oh, he's got ADHD. I'm like, yeah, but he's got all these learning issues. Right. You got to fix that first and see, So that's where I go.
Yeah, and that goes to how we doctors we say don't just look at the symptoms. Look at the whole picture, the whole patient, the whole child. Because they're not an isolated symptom of not paying attention when they're spoken to directly. You look at the whole child and you can see that, in fact, actually he does often, if he's understanding what's going on, if he's not on the spot, he does pay attention when I'm talking to him. It's only when the reading is involved, or the spelling is involved, or there's a lot of attention or some other issue. And then taking the rest of it into context also helps too.
Another thing that comes to mind is when our son would talk about or do something that he loves. He could have a conversation with you directly, going on and on and on and on and on. If it was something that he was uncomfortable with, yes, he would look away. He looked like he's, not yes, there is something there that you could misinterpret in each way to see, So I bottom line is making sure that there's no learning issue.
Right, and I think that it's easy to run through these questions with any child and try to make a diagnosis just with this, but you do need to take the whole child into context and rule out the learning issues, because that's something that gets fixed a totally different way.
And is it all the time or just in certain circumstances?
Right, exactly.
That was for me a big thing, because we were we talked about he could sit down for hours doing Legos, but then he was writing and 5 minutes later he was like, I'm done.
Right, exactly.
And I was like, okay, how can you be so dexterous and so concentrated for hours and hours and hours on this thing and not here? That didn't make sense to me. So if there's little things like that, if your son never sits down with anything, or then okay, maybe it's not the same. But if there's one section is like totally the opposite,
then I need to look into it.
Then I would question it. Yeah.
Exactly. So just another one of the questions and how to tell the difference between ADHD and dyslexia. I hope it was helpful for you, and look for the next one coming up soon. Thanks.
Thank you.